Hello, I'm Stephanie Wolf with Channel 2 News, and today we are talking about the H1N1 swine flu pandemic of 2009-2010. We have exclusive footage from the previous swine flu outbreak. We will be playing past clips from our Channel 2 News from when the swine flu was at its peak.
Good morning. This is Sabrina coming to you live from Channel 2 News. I am here to give you an update on the perpetual breakout of H1N1, otherwise known as the swine flu. There has been an increasing number of confirmed swine flu cases, and this week there have been about 300 newly confirmed. That brings the total up to approximately 115,000 in the United States. That is why we have made it our goal to keep you informed, aware, and healthy. Scientists are working very hard to understand more about this virus, but until then, we will just have to let you know what we know. This isn't the first outbreak that we've had of the swine flu. There was one in 1988 as well. The first recorded death was in September. Barbara Ann Weiners, a pregnant woman, 32 years of age, contracted the swine flu after she visited a hog barn at the county fair in Wisconsin. They were able to deliver her baby. However, she died 8 days after starting to show flu-like symptoms. These symptoms would include sore throat, coughing, runny and stuffy nose, chills, fatigue, body and headaches, and a fever, although there have been cases where a fever has not been present. The H1N1 virus is like a domino effect in your body. Once the virus affects your respiratory system and decreases the amount of oxygen being carried throughout your body, it can affect all your other systems as well. Scientists have reason to believe that since the virus is similar to other influenzas, that it is created and multiplied like them too. Swine flu, probably like the other influenzas, are mutated DNA that multiplies through the process of RNA. This process also allows it to spread throughout the body at an efficient rate. The best advice for preventing this virus is to keep your distance from others and always wash your hands, because it could be anywhere. So here's a clip that one of our viewers sent us on how they got infected with swine flu.
Come on, pig, get in the crate. It's for your own good. I don't want you hurting anybody, okay? Alright? Oink, oink. Ah! Okay, I think I'll be alright. I just can't get infected. I don't want to be one of those 88 million infected. As long as I don't have a fever, I'm coughing, a runny nose, or any other flu-like symptoms, I'll be alright. I just can't get sick. What was that? Oink, oink. What? Ah! 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 It's behind me! Ah! Ah! How'd he get up here? How does he have my cat? Kitty, get away! Kitty, get away! Oh. How does this virus spread from pig to human? There's so many things we don't know!
Wink,
Why
wink.
is this outbreak in 2009 happening? Well, after 21 years since 1988.
Oink, oink.
Ah!
Oink.
Oh. I'm burning up. Oh. I've got the swine flu.
And now we have an interview from someone who experienced the swine flu firsthand. Hello, Shelby. Thank you for joining us today. I'm just going to ask a few questions about what it was like to have the swine flu.
Okay, I'm glad I could be here today.
If you know, where and how did you catch the swine flu?
Well, my older brother, who's 2 years older than me, came down with it first, and then I wasn't really around him too much. I didn't get too close to him, but I think just living in the same house is kind of how he spread it to me.
Okay, thank you. What were the first symptoms that you had?
My head was pounding, like it felt like there was just a lot of pressure and my head felt really heavy, and then I was freezing cold, and I just got the chills, and I felt like I just couldn't even move, and I had to lay in bed. So I guess that's how it all started, yeah.
Even though you say you were freezing cold, did you have a fever?
Yes, a really high fever. It was over 100. I don't remember exactly what it was. I think like 103.
Approximately how long were you sick for?
From when it started to when I was completely better, probably almost 2 weeks, really. It was pretty long flu.
Yeah, that's a long time. What were the actions that you took for easing your symptoms?
Well, I rested a lot, so I just stayed in bed. I drank a lot of fluids, or my mom made me. I did go to the doctor, but they couldn't really give me anything, since it's a virus. And they did test me to make sure that it was, well, to confirm it was the swine flu. But yeah, I just drank a lot of fluids, stayed in bed, and like put a wet washcloth on my face with the really high fever.
Although it's a virus and you can't cure it with any medications, did you take any medications to ease your symptoms?
Yes, I took Tylenol, about as much as I could take it, just to keep the fever down. And I had like a sore throat too, so that kind of took the pain away at least. And then at night I would take like NyQuil so that I could get enough sleep, because sleep really helps get you better, and I couldn't sleep without the NyQuil because I would just wake up from the fever and just be in so much discomfort.
Did you go to the doctor, and what did they say?
I did go to the doctor. This was really at the time of like the biggest outbreak of the swine flu. So when I told them, that I've had the fever for a couple days, the sore throat, the just body aches and everything else, they wanted to test me for swine flu just so they could get, a number of how many people have had it. So they tested me for that, and confirmed it, which then they knew it was a virus and there was nothing they could prescribe me. So they just said to watch my fever to make sure it didn't get too high, because that's pretty dangerous, and just kind of sent me home to rest, I guess.
So earlier you said you had it for about 2 weeks.
Mm-hmm.
Was this during school, and how long did you have to stay out of school for it?
Yes, it was during school. I want to say it was right after Thanksgiving break, because I do remember there were a couple days that I already didn't have school anyway. But I'd say I probably missed a total of I know I missed a whole week. So I probably missed like 6 days of school, because I wasn't in bed for 2 weeks, but I still kind of felt the symptoms. Even when I was back at school, I just felt like not 100%, like I couldn't go run a mile or anything.
Did you notice a difference in the symptoms between swine flu and the regular flu?
I would just say they were more intense, and it came on really fast. Like, I was fine one day, and then the next day it just started with those chills, and then it got really bad. And the worst was like my fever. 'Cause I remember my fever got so high, and I had it for so long that I got like these like fever blisters in my mouth from having a fever for so long.
Huh. That's interesting.
And I had never really gotten those with the normal flu. So,
yeah.
Yeah.
For viewers at home, do you have any advice on what are some good things to do if they're infected and how to prevent that?
Well, don't expose others, because you don't want everyone else to get it. I would just say stay in bed, drink lots of water. I guess go to the doctor to confirm that it is swine flu. And just take it easy before you're, like 100% better, because you don't want to keep, getting yourself back into feeling sick. And definitely listen to your body, because I know a lot of cases it got really bad and people needed to go to the hospital because they were so dehydrated or something like that. So I guess just make sure that you don't let it get too serious.
You mentioned going to the hospital. Did anyone in your family go to the hospital for it?
Yes. In fact, my littlest brother, at the time he was only 3 months old, had to go to Children's Hospital in Seattle because he got the swine flu. And his was so serious that because the swine flu affects the younger and the older more seriously, just because they're not strong enough to fight it off, like someone my age is. But yeah, he went to Children's and he got an IV because he was dehydrated, because he wouldn't eat or drink. And then they gave him like a little inhaler, just because it really affected like his breathing, and he was breathing really fast, and his nose was all plugged up, and it was just really sad to see him like that.
Okay, go.
Keep your hands back here. Yeah.
With the swine flu in effect in 2009-2010, we know it had affected not only our health, but as well as our way of life. When 1 in 5 Americans had the swine flu, we changed our way of life. Normally, without the swine flu outbreak, people would shake hands, hug, or sometimes an occasional kiss on the cheek. But with the swine flu everywhere, people thought about their health and decided to not risk becoming infected with the virus. The flu also affected the medical world. Doctors were in high demand, as well as epidemiologists, to find a vaccine that could prevent and cure the swine flu. To make finding a cure even harder, the virus mutated and was similar to the way the HIV virus works, where the virus constantly changes and a problem unravels to where now you're trying to fight 4 different viruses at once. The economy suffered as well. When people were too sick to work businesses and businesses started to fail and the economy tanked. The world, and especially America, seemed like a hopeless cause. Then people started to wash their hands as much as possible to prevent the virus from spreading even further, and new regulations went into effect for public safety. With people consistently washing their hands, people were able to reduce the risk of swine flu because it couldn't spread as much from door to door. Luckily, scientists were able to find a vaccine that can be used to help prevent the H1N1 swine flu virus. Doctors strongly recommend getting this vaccine to prevent future outbreaks like the previous 2 in our history of America. Thankfully, we know from this horrendous experience about germs and viruses and the way they spread, as well as the effect a disease can have on our way of life.